We begin in Canada, where Canadian Prime Minister Justin Trudeau has announced a proposed ban on the purchase, sale, and transfer of handguns in Canada in the wake of the two recent mass shootings in the U.S.
Meanwhile, in Washington, a bipartisan group of senators are meeting today to discuss legislation on gun violence. But one doctor says the recent violence demands not only legislative policy-based solutions, but also public health ones as well. Joining us now is Dr. Megan Ranney. She's an emergency room physician and academic dean of public health at Brown University. Dr. Ranney, thank you for joining us today. Of course, you advocate for public health solutions to deal with the gun crisis in this country, but explain what those solutions might entail and why the current discussions don't seem to include them.
So as an emergency room doctor and a mom, I know that we have to do something different about firearm injury in this country. I've been practicing for almost 20 years, and I can't begin to tell you how many patients I have taken care of who have lost their lives at the other side of a gun. As a public health practitioner, I also know that the number of gun deaths in this country has been increasing year on year for over a decade. Firearms are now the second leading cause of death for children in our country. That is an unacceptable statistic. So policies are certainly part of the solution. And there are some policies that can make a huge difference. Things like universal background checks, limiting access to firearms for people who have been convicted of domestic violence. But the public health approach is about more than just policy. Policy alone is never sufficient, as we saw with COVID. It's also about identifying all the steps that lead to that moment where someone misuses a gun. It's about changing the structure of a community. Things like greening vacant lots in cities that's been shown to decrease the number of gun violence incidents in those cities, in the areas surrounding the community gardens. It's about things like helping teachers to identify kids at risk of mental health problems and deliver appropriate care. There's a whole series of preventive actions that we can take before the moment comes where someone picks up a gun to hurt themselves or hurt someone else.
For sure, a multi-pronged solution is necessary. But I want to ask you, in your experience as a doctor who's dealt with gun violence in the hospital at the point where you're trying to save lives, can you speak to how these sorts of injuries and gun injuries have changed over the years as the types of weapons have changed? You know, I was reading a doctor saying that they used to be able to just remove a bullet from the lung, but now lungs are being exploded. Can you talk a little bit about the different types of injuries you're seeing?
Absolutely. So handguns are still the primary cause of gun death in this country. Most gun deaths are actually suicides and homicides as well. Handguns continue to cause tremendous damage. But AR-15s and the equivalent do cause so much more damage to organs, not just because of the way that the bullets explode, but also because there are more of them. There is nothing as difficult as a physician as knowing that there is nothing that you can do to save a patient's life. And that's unfortunately the position that we're being put in now.
Dr. Megan Ranney, thank you so much for joining us. We appreciate your insight into this issue that affects all Americans. Thank you.
Thank you.